We're in the middle of summer. It's time to wear shorts and capris. Love the capris. Almost every day. But some people shy away from that type of clothing this season because of the appearance of their legs. Varicose veins are not only unsightly, they also can be painful. Many people with varicose veins simply live with it, but my next guest is here to say you don't have to. Dr. Lucy Laperna from Riverside Radiology is here. Joins me to talk about varicose veins. Welcome, Lucy. Welcome back, I should say.
Thanks for having me.
Tell us, first of all, a little bit about your background and how you became to specialize in the treatment of varicose veins.
Okay, well, I'm a vascular medicine specialist, which is kind of a unique little niche group of internal medicine doctors who had a passion for vascular disease. And when I first started seeing varicose vein patients about 10 years ago in my practice, I had to send them to a surgeon for a surgical stripping. And then through ultrasound technology and this latest wave of minimally invasive procedures, was able to learn endovenous laser ablation. And so we do in the office now. We get rid of these big veins that used to have to be surgically stripped.
3 cheers for technology. What exactly are varicose veins? I mean, you think you see them when you know them when you see them, but what are they?
So varicose veins are basically dysfunctional surface veins. So your leg has really 3 layers of veins. Well, more than that, but 3 big layers.
We're looking at them right now. I guess you can.
Okay. Yeah. So this is a picture of your saphenous vein, which is the primary surface vein on your lower extremities. It is normally able to keep flow going in one direction, which is up, which is what you're seeing at on my left-hand side of the screen. However, when these valvular pieces of tissue break down, either from pregnancy or just your genetic tendency, flow can actually come back down the leg. And then that leads to this tortuous, kind of serpiginous, dilated vein network that then feeds into other veins and then ultimately affects the skin and soft tissue of the extremity.
I like that word, serpiginous. I'm going to try and use that later on.
Okay.
In the show. How are these different from what people say spider veins all the time? How are they different?
Well, they're different in their location, B, their size, and their appearance, obviously. So when you look at somebody who has just the ropey varicose veins, all you see is a bland lump, right? It's just a lump.
Yeah.
But when you see somebody who has spider veins, I mean, you can see the purple pattern that literally looks like a spider or a tree, and that's really how they differ.
Yeah.
And the spider veins can occur in a leg that is normal in its physiology and function, but it's just a cosmetic, it's a purely cosmetic problem. The difference in how you differentiate is not only in your physical exam and where those spider veins are, but then also are they associated with any of these lumps, and do those patients have symptoms of heaviness and fatigue that would make you think, well, maybe there's some dysfunction going along with this.
Are some people more prone to this than others?
Absolutely. So the biggest factor is genetics. So, people say, well, it's just women because women have babies, and certainly pregnancy is a huge factor. But your genetic tendency really drives a lot of that. Even if you have pregnancy, you're not going to necessarily get varicose veins. Who does and who doesn't? Some of that is really dependent on their genetic tendency.
Let's look at some before and after pictures here, and maybe talk about some of the treatments as we're looking at some of these pictures, and you can just sort of go into that. They're certainly unsightly.
Yes, they are very unsightly, and if you can imagine the pressure that builds in that vein over the course of the day is amazing. And so patients generally feel a lot of heat and itching, burning. And that is a wonderful result. That is most likely a vein branch coming off of the saphenous vein that was treated in 2 phases. The first phase being laser of an underlying dysfunctional vein, and then most likely this patient either had some phlebectomy or foam sclerotherapy, or sclerotherapy as an adjunctive layer on top of that. Similarly, this actually looks like a short saphenous vein. So it's the great saphenous vein is the one that we showed in the anatomy picture. The short saphenous vein is behind your leg, and most patients come with a little vein that pops out at the back of their calf and travels down the side of their leg. And this is treated with endovenous laser ablation, and you treat the underlying vein segment. Same thing here. Everybody has their own kind of unique anatomy. Part of our evaluation when we see patients like this is getting a roadmap ultrasound. That's key in our decision making in terms of, what are your best treatment options.
Well, certainly some tremendous results we've seen there, and we've got your name and number there and your website on the screen. That's the best way to get a hold of you?
It is.
All right. Dr. Laperna, thanks. Good information.
Thank you.
And I learned some new words at the same time.
Don't forget them.
Thanks for being here.